Men over 60. What you reach for in the first 5 minutes after waking can change your day. Gentlemen, small choices every morning, a warm cup, a quick shot of juice, the routine you repeat without thinking, either help calm the low-grade inflammation around your prostate and improve pelvic circulation, or they prime irritation, interrupted nights, and the kind of unease that nudges you away from the life you want. Today, I'll walk you through 3 drinks that may help support your virility and 3 common morning drinks that tend to work against it. I'll give you exact recipes, timing, simple substitutions, safety notes, and realistic expectations so you can start tomorrow and know what to expect in the first 3 weeks. I've spent more than 15 years as a practicing urologist, seeing the same pattern in men across towns and professions. I've treated retired mechanics, postal workers, veterans, and grandfathers who tell me the same 2 things. They want quiet nights and confidence during the day. You may already know the symptoms: waking 2 or 3 times at night, a hesitant stream, that nagging urgency that shows up at the worst moments. Those symptoms are rarely the work of a single villain. They usually come from 2 basic modifiable processes: low-grade inflammation in the prostate zone and reduced pelvic circulation. Think of inflammation as the tissue around the urethra swelling slightly, acting like a tightened ring that makes flow harder and irritability higher. Think of circulation as traffic. When the roads to the pelvic organs are clogged and slow, the tissue doesn't get the oxygen and nutrients it needs, and healing slows. Both of these problems are quiet most of the day and louder at night, and both respond to consistent, low-risk habits that nudge your body's environment toward repair rather than irritation. The morning matters for 2 reasons. First, your body's absorption and hormonal signals are reset after sleep. Simple inputs taken early tend to have disproportionate influence on how inflammation and circulation behave through the day. Second, the morning is a practical ritual. If you establish a small sequence that becomes automatic, it's the easiest place to stick with something long enough to see real change. If you're ready for short, clinically minded habits that help men over 50 keep their nights and mornings back, subscribe now and tell me where you're watching from. Stay with me. These are simple changes that fit into a coffee routine or replace a sugary grab-and-go breakfast. Now, let's get practical. Below, I'll list the 3 drinks that can support better circulation and a calmer inflammatory state in the pelvis, and then 3 drinks you should avoid first thing in the morning because they commonly make symptoms worse. For each friendly drink, I'll explain why it helps, give a precise, repeatable recipe and timing, and point out any safety cautions you should consider.
For each harmful drink, I'll explain why it tends to aggravate symptoms and offer a reasonable swap you can try immediately. 3 drinks that boost your virility. 1. Turmeric plus black pepper morning mix, the cornerstone habit. Why it helps. Turmeric contains curcumin, a compound associated with reduced low-grade inflammation in several tissues. Curcumin's effectiveness is limited by how well it's absorbed, and that's where black pepper matters. Piperine, the active component of black pepper, increases absorption of curcumin, in some studies by as much as 20-fold. Taken together, a small, regular morning dose can create a less inflammatory pelvic environment over days to weeks, which often translates into fewer nighttime awakenings and less urgency for some men. Recipe and preparation exact. Use 1 teaspoon of turmeric powder plus a pinch of black pepper, roughly 1/8 teaspoon, stirred into about 8 ounces of warm, not boiling, water, or into a warm milk alternative if you prefer a creamier drink. Add an optional teaspoon of honey for sweetness, or a teaspoon of coconut oil for better curcumin solubility and to soften the taste. Stir well until the turmeric looks dispersed. Sip slowly on an empty stomach at least 10 to 15 minutes before coffee or breakfast. Timing and practice. Take this every morning. The most reliable pattern is to make it the very first thing you drink. Consistency matters more than intensity. A small daily habit will usually be more helpful than an irregular high dose. Expect subtle shifts in the first week, clearer improvements by the second week, and more cumulative benefit by the 3rd week if you keep at it. Precautions. Turmeric curcumin can interact with blood-thinning medications, anticoagulants, and may affect gallbladder function in some people. If you take blood thinners, have a bleeding disorder, are scheduled for surgery, or have chronic bile duct problems, check with your clinician before starting a regular turmeric routine. 2. Beetroot juice, circulation-focused support. Why it helps. Beetroot is rich in dietary nitrates, which the body converts into nitric oxide. Nitric oxide supports vasodilation, the widening of blood vessels, which improves blood flow to tissues, including pelvic structures. Better pelvic blood flow can help relieve congestion and support normal function. For men whose pelvic symptoms include a sense of fullness or poor flow related to circulation, this is a useful morning option. Recipe and preparation. Fresh is best. Blend or juice a medium beet to yield about 3 to 4 ounces of beetroot juice. If the flavor is too earthy, blend the beet with a small apple or a thumb-sized piece of ginger to add sweetness and a bit of zing. You can dilute the juice with a little water if you need a gentle taste. Drink this mid-morning or with your morning beverage routine. It does not need to be taken on a completely empty stomach if that's not comfortable.
Timing and practice. Consider alternating days with your turmeric mix or using beet juice a few times per week. For men on medications that affect blood pressure or on PDE5 inhibitors, commonly prescribed for erectile function, it's wise to discuss beet juice timing with your provider because nitrates can interact with blood pressure-lowering effects. Precautions. Beet consumption can change urine and stool color to a reddish tint. This is harmless, but can be alarming if you are not expecting it. Avoid large, concentrated amounts if you are on medications that lower blood pressure or if you have unstable blood pressure. Ask your clinician if you are on nitrate-based medications or have a history of low blood pressure episodes. 3. Green tea with lemon, antioxidant and mild circulation support. Why it helps. Green tea contains catechins, including EGGC, which have antioxidant and mild anti-inflammatory effects. Green tea's warm, mildly astringent nature supports circulation without the acidity of black coffee when taken without sugar. The lemon provides flavor and a small boost of vitamin C, which can modestly influence the bioavailability of certain plant compounds. Recipe and preparation. Steep a quality green tea bag or 1 teaspoon of loose-leaf green tea in water just under boiling, about 175 to 185 degrees Fahrenheit, for 2 to 3 minutes to avoid bitterness. Add a squeeze of lemon and sip slowly. Avoid adding sugar or heavy sweeteners. If you are caffeine sensitive, opt for a half-cup brewed or a decaffeinated green tea. Timing and practice. Have this in the morning or mid-morning. It's a low-acid alternative to strong black coffee and can be combined with either the turmeric mix or beet juice on alternating days. Because green tea contains caffeine, avoid it close to bedtime if you have sleep problems. Precautions. Green tea contains caffeine and can interact with stimulant-sensitive conditions or certain medications. If you are on medications that interact with caffeine or have arrhythmias or other stimulant-sensitive issues, check with your clinician. 3 drinks that weaken you. 1. Acidic black coffee on an empty stomach. Why it tends to harm. Strong acidic coffee first thing can irritate the bladder and lower urinary tract for some men. The acidity and gastric stimulation can prime inflammation and increase sensitivity, leading to more urgency and more frequent nighttime awakenings. Many men who reach for a strong black coffee before they eat notice worse urgency and interrupted sleep. Safer sequence and substitutions. If you can't give up your coffee, switch the order. Start with the turmeric plus black pepper mix or a glass of water. Wait 10 to 15 minutes, then have coffee with or after breakfast. Alternatively, try low-acid coffee, cold brewed coffee, which is typically less acidic, or a lower acid option like green tea in the early morning. If coffee makes you jittery or interrupts sleep, reduce intake or move it to earlier in the day with food. 2. Sugary beverages and heavily sweetened breakfast drinks. Why they tend to harm? Sugary sodas, pre-sweetened smoothies, and fruit juice-only breakfasts create metabolic spikes that encourage systemic inflammation. Repeated sugar loads prime inflammatory pathways and fluid shifts that can worsen pelvic irritation. They also create a cycle of energy crashes that make sleep and daytime energy worse. Safer swaps. Replace sweetened drinks with one of the morning helpers, the turmeric mix, beet juice diluted with water, green tea, or simply water with a splash of lemon. If you want a fruit element, mix a small amount of whole fruit with unsweetened yogurt or add a small apple to your beet blend rather than drinking straight fruit juice. 3. Alcohol, especially in the evening. Why it tends to harm? Alcohol is a bladder irritant and disrupts sleep architecture. Even moderate evening drinking increases nocturnal awakenings and can worsen urgency. Alcohol also dehydrates and can reduce the quality of restorative sleep, which compounds inflammation and circulation problems over days. Safer evening habits. Cut down evening alcohol or replace the final evening drink with a non-alcoholic alternative, such as an herbal tea, sparkling water with a splash of citrus, or simply a glass of water earlier in the evening. If you do drink, try to finish alcohol at least several hours before bedtime and hydrate with water afterward. Patient stories that illustrate realistic change. These are anonymized, representative accounts from men I've worked with in clinic. They're intended to set expectations, not to promise outcomes. Stephen, a retired mechanic, started the turmeric plus black pepper mix every morning. He told me he felt a subtle lightness in his pelvic area within about 10 days, and slept longer stretches by the second week. He didn't quit coffee, but he moved it to after breakfast and reduced how strong it was. Over 3 weeks, his nocturia decreased from waking 3 times to waking once most nights. Richard, a retired postal worker, began alternating beet juice and turmeric 3 times a week. He noticed better endurance when walking and fewer sudden urges. By day 12, he reported sleeping a solid 5 hours for the first time in months. He kept seeing gradual improvement as he maintained the habit. Marvin, a veteran, chose green tea with lemon as his early morning swap for black coffee. He added the turmeric mix on alternate days. Over 3 weeks, his urgency episodes during the day decreased, and he felt more confident going on longer errands without the same level of concern. Arthur, a grandfather who loved evening wine, decided to cut back on nightly drinks and replace his last glass with herbal tea. He combined that change with the early turmeric mix.
Within 3 weeks, he described better morning energy and fewer sleep interruptions, and he felt more like joining his grandkids for a morning walk. Week by week expectations, conservative and practical. Week 1, you'll notice subtle shifts. Many men report a sense of lightness, a small change in pelvic sensitivity, or a sense of having a little more energy in the morning. These are often the earliest signs that the inflammatory environment is shifting. Week 2, symptoms like frequency and urgency often become less bothersome. Some men sleep for longer stretches. Flow may begin to feel steadier. Don't expect overnight miracles. These are gradual changes tied to regular practice. Week 3 and beyond, cumulative improvements are more noticeable. Sleep quality often stabilizes, daytime confidence returns, and routine activities feel less constrained. For men who pair these drinks with other good habits, hydration earlier in the day, reduced evening alcohol, and regular movement, results tend to be stronger. Safety, interactions, and when to see a clinician. These drinks are supportive, not replacements for medical evaluation or treatment. If you have new, painful symptoms, blood in the urine, a sudden inability to pass urine, fever with urinary symptoms, or rapid worsening of symptoms, seek medical attention promptly. Specific interaction cautions. Turmeric, curcumin, may interact with anticoagulants and antiplatelet agents. If you're on blood thinners, have a bleeding disorder, or are scheduled for surgery, talk to your prescribing clinician before starting a daily turmeric regimen. Beetroot juice, high in dietary nitrates and can lower blood pressure. If you take antihypertensives or nitrates, consult your provider about safe timing and amounts. Be mindful if you take PDE5 inhibitors, discuss combinations with your clinician. Green tea contains caffeine and can interact with stimulant-sensitive conditions or certain medications. If you have arrhythmias, uncontrolled hypertension, or are on medications that interact with stimulants, check in with your clinician. Do not stop or alter prescribed medications based on these suggestions. If you are on anticoagulants, vasodilators, blood pressure medications, or medications for erectile function, speak with your healthcare provider to understand safe combinations and timing. Practical routine and do's and don'ts for consistency. A simple morning sequence that many men find helpful is: wake, hydrate with 6 to 8 ounces of water, prepare and sip the turmeric plus black pepper mix, 1 teaspoon turmeric plus pinch 1/8 teaspoon black pepper, in warm, not boiling water or milk. Optional, 1 teaspoon honey or 1 teaspoon coconut oil. Sip slowly on an empty stomach. Wait 10-15 minutes before coffee, or have your green tea instead of strong coffee. If you prefer beet juice, have it mid-morning or alternate days with your turmeric mix. Do keep it consistent. Make the mix at the same time every morning so it becomes an automatic habit. Track changes. Note how many times you wake at night and any changes in urgency. Small tracking helps you and your clinician monitor progress. Pair drinks with other healthy habits: hydration earlier in the day, light morning movement like a short walk, and reducing late-night alcohol. Don't expect immediate, guaranteed fixes. These are supportive measures that work best with consistency and sensible lifestyle patterns. Ignore red flag symptoms. Seek medical evaluation for severe or sudden changes, pain, bleeding, or inability to urinate. Common questions and practical clarifications. How long should I keep these habits? Give any of these routines a consistent trial of at least 3 weeks to evaluate effects while discussing ongoing symptoms with your clinician. If something causes digestive upset or other side effects, stop and consult your clinician. Can I combine all 3? You can alternate them. For example, turmeric each morning, eat juice 2 or 3 times a week, and green tea on days when you need a lighter lift. Combining everything every day may be unnecessary and could complicate medication interactions, so coordinate with your clinician if you want to stack them. What about dosing higher amounts? More is not always better. The recipes I gave are conservative and designed for daily use. High-dose supplements and extracts should be discussed with a healthcare professional. Red flag symptoms that need prompt evaluation: painful urination, visible blood in urine, fever with urinary symptoms, sudden inability to pass urine, or rapidly worsening urinary retention are urgent and require immediate medical attention.
New or unexplained weight loss, severe pelvic pain, or significant changes in general health should prompt an evaluation. Final encouragement and next steps. Your prostate and pelvic circulation are responsive. Small, consistent inputs in the morning can shift the internal environment from inflammation and congestion toward repair and better function. These drinks are practical tools. The turmeric plus black pepper mix is a low-cost, low-risk cornerstone that many men find helpful when taken daily. Beetroot juice supports circulation for men who need it, and green tea is a gentler, antioxidant-rich alternative to early acidic coffee. At the same time, reducing or altering coffee on an empty stomach, cutting sugary drinks, and curbing evening alcohol are practical swaps that often reduce symptoms simply by removing sources of irritation. If this message resonates, like and subscribe for more clinically minded practical habits for men over 50. Tell me where you're watching from in the comments. I read them and I want to hear how these small changes fit into daily life where you live. Medical disclaimer: this content is for educational purposes only and does not replace medical advice.
It is not intended to diagnose, treat, cure, or prevent any condition. Consult your healthcare provider before starting new supplements or significant dietary changes, especially if you are taking anticoagulants, antihypertensives, nitrates, PDE5 inhibitors, or other prescription medications, or if you have a chronic medical condition. If you experience severe, painful, or rapidly worsening urinary symptoms, visible blood in the urine, fever, or inability to pass urine, seek urgent medical care. Thank you for taking these minutes to prioritize small, sustainable changes. Start with a single teaspoon and a pinch of pepper tomorrow morning. Keep it up for 3 weeks, track how you feel, and check in with your clinician when necessary. Small, consistent steps give you more quiet nights, steadier days, and the confidence to keep living fully. If this helped, like and subscribe, and talk to your provider about how these habits might fit into your individual care.